This is Talk Business and Politics with Roby Brock.
And welcome to the program. I'm Roby Brock. We're glad to have you with us. I'm joined by Troy Wells. He is the CEO of Baptist Health System, and you've been a little busy lately with a little activity this past year.
2018 was a busy year for us. Thank you.
The big acquisition of Sparks, I think, is probably the feather in your cap at this point in time. 492 beds in Fort Smith, 103 beds in Van Buren. Tell me why this deal made sense.
Well, I have to answer that frequently, as you can imagine. It was a big acquisition for Baptist Health, and what I always tell people when we've had opportunities like this one, we always ask ourselves three questions, along with due diligence, obviously. But one, is it consistent with our mission and the direction of our Board of Trustees? The second question is that we have to answer, with our help, can we improve health care for people in that community, and can we improve their operations? And then the final question is, once we've done all that, can they make a positive contribution to the health system so it's not something that we're having to continuously support on an ongoing basis? Mm-hmm. And in this case, the answer to all those questions was yes. And so we proceeded. And it was not without a lot of due diligence, a lot of time and thought. But you know, the thing that was really interesting about this one that's been different for us is dealing with a publicly traded company. So there's a lot you don't have access to during due diligence because they can't let anybody know you're doing it.
Yeah, they'd have to disclose that in some SEC filings.
So you don't get a lot of context and culture questions answered. You get numbers, and that makes it a little bit difficult for us. But it turned out to be a really great decision. Yeah.
Of course. Yeah. There has been a lot of turnover in that market in ownership. There's been some executive turnover in that market. I would imagine that you're going to probably preach a message of stability in the market based on what I've seen in Central Arkansas. Is that something that you've picked up on from the community?
We have definitely, from the employees to community members. They've, of course, quick to tell you how many CEOs they've had run through there in the past 10 years. They're quick to talk about the transactions that those facilities have been through with publicly traded companies. So they're looking for stability, and you know, we've had tremendous amount of support, and I think people recognize, while they're not as familiar with our brand out west, they still know us, and they've done their homework, and they're looking forward to that stability. And to your point, I mean, we pride ourselves on stability of leadership and culture, and the staff and the community recognize it and are wanting that.
So you do have to look at some things and say, we do see some room for improvement in here. You alluded to that earlier.
Right.
What's going to change?
Nothing dramatic on the surface. You know, again, back to the due diligence, there's a lot we couldn't learn before we actually had to sign the asset purchase agreement, which was kind of crazy for us. But, you know, we're in the process of getting to know the people, getting to know the medical staff, getting to know the needs in the community that we can help meet as part of our faith-based mission. I mean, that's real important to us. And so that'll take a little bit of time. The big priority right now is just a transition. As you know, when you acquire another business, there's a period of time where getting new systems in place and integrating the business is really the first step you got to take. But certainly we're on a listening mission right now.
Well, at least you're in a particular industry that there's never any change in, because you know healthcare is just completely
boring.
Yeah, exactly.
Yeah,
and
right.
it's stagnant. Nothing ever changes there. Let's turn our attention and talk about some big picture stuff. You've
Sure.
got a divided Congress now.
Right.
Which probably means the Affordable Care Act stays intact, because
Right.
there's not going to be enough momentum to change anything.
Well, at least from a legislative perspective.
From a legislative perspective.
So now you got the lawsuits that are
Right.
challenging the law. And then you have to think about regulatory action. So there's been a lot of activity on regulatory action that affects people that are covered under the Affordable Care Act. So there's still some things to be cautious about.
Let's take this in two parts then. What are you concerned about that might change in the Affordable Care Act, whether it's through regulatory action, executive action, or legal action?
Well, probably the biggest one is if the individual mandate ends up throwing the whole thing out. That could be pretty disruptive, and then it's back to more lawsuits, I suspect, which is what we've seen so far.
Yeah, I think there'll be an appellate process.
Yeah, there will be.
I can't imagine that the lower court is the final word on that.
So the overall big concern, short of it just totally imploding, would be continued erosion in the number of people that have coverage as a result of the law. So if that continues to erode, then it becomes less effective.
We're in an enrollment period right now, so we really won't have those numbers for a few more weeks. So anything that you're seeing preliminarily that is encouraging?
I have not seen those numbers. I'm cautious in observation of the Arkansas Works piece of that, and that the people who are rolling off, we're up to, I think, a little over 12,000 people now that have rolled off. If that continues at the pace it's been on, that raises quite a few concerns. And I think it's just real important that we support our legislator and our governor to make sure that we take steps to not have people roll off inappropriately.
Yeah, and I have pried a little bit on those numbers, and about a third of those numbers that have rolled off, they just don't have any information on them. I mean,
Right.
that's the problem, is
Yeah.
they haven't been able to connect with them. They've moved away. They've dropped out of the system and off the planet, quite frankly. I guess the governor has told me that where he is watching is, are we seeing ER visits ramp up? Because
Right.
that might be where people enter the system if they've lost their
Yeah,
health
uncompensated care in
insurance.
the ER.
Are you seeing that?
No, we haven't seen that change yet. There's probably going to be a lag. You know, people lose coverage, and then at some point in the future, they have a need.
Is that a good bellwether, do you think?
The numbers are so small in the whole scheme of things. You could look at maybe a facilities ER, one place, and recognize a small change, a small shift. But in the whole state of Arkansas, I think it'd be hard to tie uncompensated care to just one thing like ER visits.
Okay.
My hope is, by the way, that those 12,000 people, or 9,000, the three that disappeared,
Right.
that they're all finding jobs and going to work and don't need it.
Yeah.
And that's what we all want.
Or maybe a few of them re-enroll after first
Yeah,
of the year,
that's
which would be
right.
another option for them
Yeah.
too. Payment protection, payment provider initiative, that has been something that has been a big healthcare push in Arkansas, where you've seen the doctors kind of align a little bit so that the payments are running a little bit more through the whole system versus fee for service. Is that working in your?
Well, we've got like value-based care, value-based payment models, I guess is what you're referring to, and we've been involved in 2 or 3 for the past several years, working really closely with physicians and trying to figure out how to spend less money, take better care of people, monitoring quality, and rewarding providers for doing a good job with their patients. And we've had limited success, I think.
Yeah.
There's a big push from the federal government with the Medicare program. We're involved in a accountable care organization. It's a joint venture with Baptist and UAMS that we're doing together, and we've got 35,000 Medicare lives that we're responsible for the total cost and quality of that health care provided to those individuals. So we're in the first year, and so far it's going well, but you really need multiple years to see how you're doing.
Last question for you. So is there anything you need to see changed in the current either Affordable Care Act model or something that's happening at the state level that you feel is not being taken care of?
I don't know of anything specifically. I mean, the concerns are the same. It's, you know, how do we take good care of people in a way that we can afford it as a society? And healthcare is really expensive. There's a lot of focus on the cost of healthcare, obviously, and for good reason. But the important thing is we remember when we're having these policy discussions and talking about what needs to change in law that we focus on people. Because I think if we look back, we'll find that when we make decisions that don't do good for people, they end up getting changed later.
Yeah.
They don't last. And so I think it's just, this is a people issue.
All right, he's Troy Wells with Baptist Health. Always good to see you.
Thank
good
you,
to catch
Robbie.
up.
Thanks for having me on.
And congratulations again on the big acquisition
Thank
up
you.
there. All right. We're back with more right after this.